Thanks very much. If you are or you have an elderly relative in care, how worried are you about the prospect of some care homes no longer being viable effectively? The clock is ticking on care home workers who the government says will be sacked if they refuse a COVID jab. There are currently more than 100,000 of them who are yet to be vaccinated. One doctor put it evocatively when she said recently that a labour shortage in the care sector meant there was a prospect of older folk dying alone, quote, in urine-soaked beds. Well, obviously, we don't know how many of those 100,000 care home staff may yet decide, when it comes to the crunch, to have the vaccination the government insists they must have. But in the run-up to Christmas, the care sector labour shortage is likely to be exacerbated by the demand for seasonal workers. For instance, Amazon is reportedly offering a £3,000 signing-on bonus. And that's the context for an intervention by NHS providers, which is advocating a £500 Christmas bonus paid for by taxpayers for care workers in England. Well, we're joined by Adam Purnell, Director of Social Care for the Institute of Health and Social Care Management. Adam, thanks so much for your time. Do we need this bonus?
I think, yes. I think this bonus should have been given to our care workers months and months ago. If we look back earlier on in the pandemic, our devolved states, their care workers got a £500 bonus. England didn't receive it. So I think I don't want to say anything that's going to take away from the possibility that our workers are going to get recognised with some sort of monetary thank you. I think it's definitely needed. I don't necessarily think it's the answer. I think if you speak to a lot of care workers and care providers in, say, Scotland and Wales, they will say that £500 bonus didn't actually do anything to boost morale and increase recruitment and retention within the sector. Last week, we had the perfect opportunity to benefit the sector by postponing the mandate of the policy. That would have allowed at least 40,000 carers, I don't know the figures myself at the moment, to stay in the sector. But now what we've done is we've voluntarily asked them to leave and are now going, oh, we don't want anyone else to leave now, so let's give them some money and hope they stay. Whereas actually, it's only part of the problem. What we need to be doing is looking at the overall picture of why don't people want to come and work in social care? Why don't people want to stay in social care? Wages are a huge aspect of this. I personally think care workers in social care need to be paid at least 12, 13, 14, even £15 an hour. There was a report that came out, the Unfair to Care report. And if you look at care workers in the community compared to care workers in the NHS, on average, the NHS workers get £7,500 more than social care workers. So there needs to be a huge address of the disparity in wages, but also about the recognition and the thanks and the public image of social care. You know, it's a wonderful sector. We do amazing things and we've got such career progressions. I don't think people understand they can be a nurse in social care. You know, you can be a manager, you can be an owner, you can be an activity coordinator, you can do anything. And people need to see it as a lucrative sector to join.
Adam, you make a really good point. I've got to interrupt you. My own niece works in care and it's a fantastic job. It's hard to mandate respect though, isn't it?